Because I sit through it in my made-up wheelchair. It's not that I pull every time. My leg hurts. So I know this is milking. That's Keenan's seat.
No, I'm at the end.
You're sitting at the end. Yeah, no, Keenan's sitting right here. And I tried.
Go have a seat. He runs up and he says, "You got this." All right, we're getting ready to start. Thank you. You think? I mean, that's fine. Then I'll just sit right there.
Okay, perfect.
Okay. Mm-hmm. So good evening. I'm J. Maurice McCann-Spearsall. I'm the Director of HIV and Health Equity here at HRC. So before we begin, I'd like to take this time to acknowledge some HRC staff in the audience. We have our Senior Vice President of the HRC Foundation, Jay Brown. We have Nicole Kozer, our SVP of Diversity, Equity, and Inclusion. And then we have other staffers and other staffers in the building as well. So if you could just wave your hand. And we have Leslie, who's our director of our HBCU and Health Equity HBCU program, Historical Black Colleges and Universities, the HDL. And then we have Jay Gilliam, who is director of our global program in the back. But I want to give a special thanks to Dimitri O'Brien. Dimitri is our HIV and Health Equity Program Coordinator, and Dimitri was really instrumental in coming up with this idea and this concept for a program. So I want to give a special thanks to Dimitri. So we're all gathered here today because in observance of National Black HIV/AIDS Awareness Day, it's a solemn commemoration, and according to the CDC, which is the Centers for Disease Control and Prevention, blacks and or African Americans account for a higher proportion of new diagnoses of HIV and people living with HIV compared to other races and ethnicities. In 2018, black and or African Americans accounted for 13% of the U.S. population, but accounted for 42% of HIV diagnoses in the United States. Those numbers are very stark. They show that black people, particularly black and brown people, bear the burden of HIV. So tonight we bring you Community Voices, which is a partnership between the body and Native Son. So this forum was designed to celebrate the uniqueness of the collective black experience. And during the course of the evening, we will examine, unpack, and debate the impact of HIV, stigma, religion, violence, and systematic oppression on black LGBT folks and on the black LGBT community, excuse me. So tonight is just the beginning. I'm also excited to announce that we have started a national partnership with the body and Native Son. We will take community voices on the road. And in addition to panel discussions, we will host the HIV advocacy program for community leaders, health departments, and HBCUs, as well as minority-led and serving community-based organizations. Our first stop will be May the 1st in Atlanta, Georgia, followed by stops in Dallas, Cleveland, and Nashville. So Community Voices is unique. It's moderated by the great and only Emil Wilbekin. If you don't know, because Emil's a household name, if you don't know, Emil is a media executive, pop culture expert, content curator, LGBT advocate, and the founder of Native Son. He's the former editor-in-chief of Vibe, Giant magazine. Who remember Giant? Former 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 managing editor of Essence.com, and former editor-at-large at Essence. Wilbekin has contributed to the New York Times, the Chicago Tribune, the Associated Press, Out Magazine, has appeared on CNN, VH1, The Today Show, PBS, BBC, and NPR. Again, the brother's a household name. So without further ado, I will turn this over to Emil.
Wow, thank you. Well, hello, DC. I'm so grateful to be here, and I'm so grateful to HRC for hosting us here to create this space so that we can have this conversation. It's a very, very important conversation. I'm a black gay man who is 52 years old and is HIV positive, so if we look at the stats, I'm not supposed to be here. So I will open with that. So I want to talk to the panel, and I'm just going to toss it, and you all respond as you feel fit. The numbers, as Jay Maurice just said, are staggering, especially for black gay men. 1 in 2 will be HIV positive or living with AIDS within their lifetime, so that's half of our population. Why do you believe the numbers of HIV and AIDS infections are so high for black gay men and teens right now?
Oh, I got the mic. Oh, all right. Okay. Can you hold that?
Yeah, I got it.
All right.
I know you
That was
were
gonna say.
Right.
Oh, I'm not. All right. So I know, right? Because I can go off. No. So I'll start.
Please introduce yourself first.
So hello, everyone. I'm George M. Johnson. I'm a journalist, activist, and so I guess to start it off, let's talk about like the actual, like the statistic. The statistic reads 1 in 2 men who have sex with men, which is a very interesting clarification. Over time, we've unfortunately turned that into 1 in 2 gay men, and so we have to be really careful because that statistic is ballooning because in the MSM category, it also tends to include trans people. It includes people who, when they do that initial risk assessment and they ask, have you ever slept with a man in the last 12 months, it can lump certain people in who identify as heterosexual. So that statistic is, and it also states if we continue on the same track that we're on, we will eventually get to this 1 in 2 statistic. So I just want to make sure we clarify that point. The other thing about the statistic is it's alarming, and it's alarming for a lot of reasons, especially when you look at the other communities that we're comparing it to, when you compare it to brown communities, when you compare it to white community. And so the biggest thing now that I know that I'm trying to do is teach people like how the epidemic became black, because it wasn't always a black epidemic. And unfortunately, we still don't see it as a black epidemic. And the 1 in 2 statistic is just one of these statistics within our communities that is alarming. And we talk about it in a silo oftentimes. And because we talk about it in a silo, and because we don't talk about how black women also have this issue and black trans people have this issue, we then don't treat it as a social justice issue. And so that statistic is going to continue to rise until we as a whole community understand that it's not just the burden of black MSMs, it's not just the burden of black queer people, and it certainly is not the burden of people who are already HIV positive to stop the epidemic. It is a burden of sexual accountability, responsibility, and everyone within the community understanding how HIV works, how when we sleep in the same sex circles, and how the epidemic continues to stay in our communities, the barriers to care, and how they all play a role in how we got here.
Hi, yeah, yeah, thank you. I'm Kenyon Farrow. I'm the senior editor with thebody.com, as well as kind of, 15, 20 year Yeah, I guess 20-year, I don't want to admit that out loud, but 20-year kind of social justice, community organizing, writing, and communication strategy history. I was formerly the U.S. and Global Health Policy Director for Treatment Action Group. I was the Executive Director of Queers for Economic Justice. I've been doing this kind of shit for a long time. Co-edited an anthology many years ago, Letters from Young Activists, when I was still a young activist, et cetera. But so I think, for me, why the epidemic looks the way it does at this point for, you know, black, gay, and bisexual men, thank you. I mean, to a large extent, you know, with the exception of, you know, some other kind of allies in the black community and et cetera, nobody really did any fucking thing, and it didn't matter to people for a very long time, if I'm just being straight up honest, right? So the truth of it is, I mean, by 1987, we were already aware, the CDC was aware the black community was disproportionately impacted. The reports are there by the, you know, mid-late 80s, right? So that's been true for a while. And the numbers from the late 90s to the early 2000s kept going up. It was the Young Men's Survey, right, which said 25% of young black MSM were positive, right, in the early 2000s. Then it was, you know, 33%. Then it was the 46% in 2005, right? So it shouldn't be any shock that we would get to 1 and 2, right, at some point, given the kind of current conditions. I'll also say that, also, with the exception of, you know, maybe local health departments and some private funders who funded some early work, you know, to do prevention testing, other community work around HIV for, you know, black and bisexual men, SGL men, et cetera, there was no federal money. The CDC didn't put the kind of young men of color, which included all non-white, you know, quote unquote MSM, you know, federal money to roll out until 1999, right? That was almost 20 years into the epidemic. And then that money went to, you know, the kind of community behavioral interventions, right? So we're trying to sort of patchwork things without any comprehensive health care, without, you know, a whole number of things for a very long time. And so I think at this point, I think we need to be really bold in thinking, like, what are the systems that we really sort of need in place to help people who are living with HIV stay healthy, to reduce the amount of stigma in the community, so once people find out their status, they don't feel alone and don't you know, feel disconnected or like they can't go to care. And then what are the things we need to do, you know, in terms of prevention and all of the kind of modalities, PrEP and et cetera. So that's it.
Tori.
So good evening, everyone. My name is Tori Cooper. I am the Director of Community Engagement for the Transgender Justice Initiative, and I just started here. Next Friday will be 1 month. Thank you. So I am here not representing black gay men because I'm a black woman. Okay. However, it is important to make sure that we're extending the dialogue. We, as trans women, we are your sisters, we're your aunties, we're your mamas, your daughters, all of those things. We are empaths for you, and vice versa. And we share this burden along with you. As a black trans woman who lives in the South, our statistics are very, very similar, and in some cases even higher in some places in the country. So one of the reasons that I think the rates are so high is because people just didn't give a shit about black people for a long time. We had healthcare systems that weren't, what's the right word? Give me a word, Michael.
Whatever word you use.
So we had healthcare systems that just didn't give a shit about black people. And I say that with all intentionality. There were times early in the epidemic, as Kenyon so wonderfully said with the statistics that he gave, we were continually seeing headlines every day, every month, every year about rising numbers of black gay men and black men who had sex. I remember when that time came around. Put the mic down a little? Okay. So we continually saw where the numbers were rising, and no one did anything. They let you guys die. And for those, I'll be 50 years old in May. And for those of us who've been around for a long time, we saw HIV ravage communities. I'm from Richmond. I told someone earlier, I said, yo, I'm from Richmond. I figured that's why you look familiar. So I told someone, I said, I lost my virginity a few blocks away from here. I did, but then I lost my virginity a few blocks that direction too.
Okay.
But with that being said, I saw how HIV and AIDS was wiping out the community. You go to tracks.
Right. Yeah.
On Wednesday. Yeah, I was that one. I was there on Wednesday. And then you go back on Sunday, and 17 people weren't there. And then you go to tomorrow on Friday, and if you went early, you play cards, right? Upstairs? That was it. And some of us played Bill West. But then you go back the next month, and 16 people weren't there. And no one did anything. They allowed you all to die. So what do we do from here now? What do we do now?
So this is perfect turning point, Tori, to kind of guide the conversation. So the other thing that is happening that is alarming is that the numbers of young people contracting HIV is very high, especially around Black teens and young adults, which is also coupled with higher suicide rates and rates of depression. So I'm going to ask Michael, why, from a community perspective, why aren't people up in arms? Why isn't the church up in arms? Why isn't leaders up in arms? Like, if this was a white situation, it would be on the cover of the New York Times every single day till we're done.
Hello.
And introduce yourself.
Yes, absolutely. My name is Michael Vasquez, he, him. I am the director of the Religion and Faith program here at HRC. It's now my second month, so, we both knew. And I think it's important to name, as the most light-skinned person on the panel, right? Like, just gonna name it, right, that I come from an Afro-Caribbean family, and that's why I'm here. So, just name it's absolutely true, right, that this is, if this was a white issue, right, if white folk were, if this were a white problem, if this was affecting the white community in the same way it was affecting our community, there would be a national crisis. There would be media covering all of this, but because it's us, right, Black and brown bodies have never elicited the same kind of response, the same kind of urgency in any kind of issue, not just health issues, but across the board. And the church, Black and brown churches, don't know how to respond, because the need for Black and brown churches has been to, how do we survive in the face of whiteness? How do we survive in the face of ongoing oppression, generation after generation? And they have continued to see this, but they have seen historically our issues as the LGBTQ community as a white issue. The way the media has portrayed us, the way the media has had this conversation is that gay issues are white issues, lesbian issues are white issues, trans issues are white issues. White people have those problems. The church understands this as a white people issue and don't see the deep historic colonial issue, right? When white folks showed up in North and South America, when the white folks showed up in Africa and saw that we had a much more diverse understanding of sexuality and dignity and humanity, and tried to legislate that with Christian doctrine in a way that was oppressive, we internalized that. And in order to survive in a white world, we have determined that we need to assimilate as much as possible to a white Christian understanding of being. And as long as that remains the status quo, we can't move forward on any number of the issues that we face, whether it's HIV, whether it's police brutality, whether it's mass incarceration. We can't move forward until we break that down. And that begins by having these conversations within our own faith communities, right? That's a willingness to go back to the places that hurt us deeply and saying, we need to re-examine the conversation, because white folks still have a a dominion over the way we're engaging about the issues that impact us the most. And if we can shift that, if we can reclaim our power, reclaim our identity, we might be able to end not just the epidemic, but really end the oppression of our community.
Wow, thank you.
And I want to add to that, to Michael's point, when you talk about the church and how the church looks at HIV and LGBTQ issues as being a white issue, that's what the narrative has been for decades. It's been, oh, HIV is a white man's disease. And it goes back to the point that Kenya made. As of 1987, we knew who the face of HIV was. So I always take offense when I hear the narrative of HIV is a white man's disease. I'm like, no. That's not necessarily so. HIV impacted all people. Who were the white people having sex with? They weren't just having sex with themselves. So I just wanted to point that point out because I think that's sometimes in the narrative, and when we talk about HIV, we forget that.
Right. But, so with that said, though.
Can I just say something real
yes,
quick
sure,
just
go
to
ahead.
add to that? And I also want us to start to be careful about giving the black church a pass as just saying, oh, that's a white issue, blah, 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 because the whole doctrine of how y'all created Christianity in this country is a white, like y'all assimilated into this, right? Like, because we know where we came from, and we know when we came from Africa, we weren't Baptists, and we weren't AMEs, and we weren't all of these things. So, like, all of your whole indoctrination was created by white people, and then you assimilated it, and so you also assimilated those same oppressive principles. And so we have to actually start to talk about that, because a lot of times we're not willing to have that conversation as well with the black church about, well, a lot of this was through assimilation and through, well, we don't have this here, so now we need to create our own because we're in this new land, so we're going to create our own forms of religion and forms and structures. But a lot of, and you know, I use the term, like a lot of times you'll hear people say like, oh, I was called a faggot before I was called a nigger, right? But the problem with that is because most of us grew up in only black communities. So when would you ever be called a nigger when you are only growing up with black people, right? So, but you have been called another type of oppressive term, right? But that oppressive term often came from your faith. So that faith, though, was also indoctrinated through white supremacy. So we have to really start to unpack that and unpack how we actually got here through religion, and also unpack the fact that young people are not going to church. They are not going to church, and they are not a part of that. They are part of more spiritual teachings now. And young people are starting to understand queerness at a much younger age than many of us did. So you have young people who are not only coming out as queer much younger, but you have young people who identify as heterosexual who have queer friends and who protect their queer friends. And so now we have to start to go to the root issue and go to, oh, she said up, you said down, listen, y'all. Right, it was about to get real triple X. So now you got to get to the root issue of that, and that starts with getting into school systems. It starts with sexual education in school systems and things that we weren't taught as queer people, and how we have to also stop demonizing queer sex, and how queer sex, you know, can no longer be looked at as this vile thing and looked at as this inhumane thing and looked at as this this abomination type of thing. And I think that's kind of how we start to get out of that.
And I think that if we look historically, right, the Black and Latinx church has served as forerunners of civil rights movements across the country, across the world. But in this new age, right, when folks, we're not going back to those places, right? Like, I'm not in a Black or Latinx church consistently, right, unless I'm there for work, right? Like, where are we forming community in order to have these conversations, right? Like, if this is a one-off conversation that we have collectively as, right, like marginalized but privileged people, right? Like, if we have access to this forum, that we have some level of privilege to be here, where are we able to disseminate this conversation in places where it is most critical, right? Because folks ain't going to church, right? And historically, when there are conversations about health, conversations about equity, conversations about access, the Black church did that at the expense of queer folk, absolutely. I won't dismiss that reality. But broadly speaking, we're not going to church anymore. So where are we having those conversations? Can we replicate some form of community, right, instead of leaning into this idea of whiteness that says, I am my own person and I am an individual, right? when we need one another in order to survive and thrive, right? Not just survive, because I'm no longer thinking that, like, you know, the civil rights movement allowed us to survive a little bit. Can we create a world where we are able to flourish and thrive? That requires, it demands that we break the curse of whiteness that says we are just individual people in an individual world, and say we will build deeply connected community that can advance the cause of justice.
So, yes, that's, please, now. So I get that from a broader perspective, but then I'm still wondering with, say, 13 to 24-year-olds, how are they getting infected? And why are they getting infected? Tori?
So for many people, around that age is when your body naturally wants sex. Your body, you may not even know those are the words, but your body naturally reacts, especially if you have a penis. It's not just a mental reaction, there's also a physical reaction that happens to stimuli. Right, Doc? So it's tribal. It is something that is innate. It is part of your DNA. And so I mentioned I'm 50 in a few months, and I say that because those of us who are around the same age, we're the first people on the face of the earth who had to change sexual practices after we started having sex. If you lost your virginity at 13, HIV wasn't a big issue in your community. But by 88, I was born in 1970, so by 1988, when I was 18, going off to Norfolk State, all of a sudden, we had to use condoms. So for people who are 5 or 10 years older than me and 5 or 10 years younger than me, we are the very first people that have ever had to do that. And so we carried those practices into our adulthood. And that's one of the reasons why, statistically, all of these guys, the black MSM, over 50, 1 out of 2 going to have HIV diagnosis in their lifetime. That's my community. Right. That's some of you guys in the room. And so younger people, they're just having sex. They thought the exact same way that we did. If I'm having sex with somebody and we can't make a baby, what's the point of using a condom?
Right.
I think there's a couple things happening. So I think part of it is in talking to some young people who are HIV positive or became HIV positive when they were young. I mean, the thing I hear often is that nobody talked to them about sex, or certainly the kind of sex that they were interested in having. And so they were having sex without any kind of conversation, context, instruction, et cetera, either in their homes or certainly not in most sex ed programs in school. And so they were having sex at the time when most of us start having sex. And, given just the dynamics of the epidemic, we're more likely to have sex with somebody who was HIV positive and undiagnosed and not on treatment, if they're black in particular, not having access to care. So some of it is just like not having comprehensive sex eds, parents that don't talk to you about sex or don't think about that you might actually, be queer or have, sex.
Or can't deal
with
it.
other queer, say what?
Or can't deal with it.
Yeah, or can't deal with it or whatever. So I think, those things are at play. And then the other thing that, I think might be a little touchy is that, I think about when I was like 13, this is where I'm going, right? You clearly did. Is that, when I was, starting to hit puberty at like 13, 14, or whatever, I started to realize when 2 things happened when I left my house. White people were all of a sudden afraid of me, right? So I would go, I'm from Cleveland originally, so I would go downtown and be running errands for my mother and doing stuff, whatever. And so I would be standing at the ATM, at a bank, and white people would just leave. They would be in front of me and they just would walk out the door. So that started to happen. And the other thing that started to happen was older men started to see me as sexually available to them, right? So I started to be literally when I was 15 or 16, it was one summer where I was followed 3 or 4 times, once by a dude in a car while I was on my way to work on a Saturday. And then one time at a mall in downtown Cleveland where I literally had to like run around the mall and shake this dude until I could like get away because he was following me around the mall, right? And I know we often talk about that in terms of like young, you know, cis women in our communities and like that particular dynamic, but I was well aware that like all of a sudden people saw me, that older men saw me as gay and as some kind of sexual object when I was like in my teens. And while I was at the time aware, and also will say too, I come from a family where like my mother was friends with all the kids, honey. There was no, I didn't come from a homophobic background at all. Like my father, my uncles, like there were queer folks in our community, right? So that didn't, I was under no delusion about my own sexuality, but I wasn't at the point where I was ready to act on it. But at that point, it was very scary, right, to be like followed around and kind of chased by. And I'm not even talking about like at 15, 16. I'm not even talking about like 20-year-olds. I'm talking about 40-year-olds, right? And I have a 19-year-old gay nephew who also tells me that online, like, you know, dude, like I'm 45. People my age are talking to him when he was 16, 17, like on Facebook and whatnot. You know what I mean? Right. So like, I have to be honest, like that, like we have to think about that dynamic within, you know, what is happening to young boys as well.
But I'll add to that. I think we also have to look at it from the flip side because, you know, maybe I'm telling too much here. When I was, there was always a creepy old dude that was like, you know, around or whatever. Or online in the chat room, whatever the case may be. But then I nationally had an attraction to some older dudes too. Like, it wasn't that they were like, you know, preying upon me. It was like I had an interest in as well. Like, so I want to like kind of us think about it from that perspective as well, that it's not necessarily always the, you know.
Yeah. No, I want to follow up with that. No, I totally agree with you. For me, though, there was a difference between when I was in like 21 and I was like having sex with dudes that were 40. I was grown at that point. I was out of my mother's house. I was doing what the hell I wanted to do. Like, you know, that was a different thing than when I was 15, right? You know what I mean? And I did not look older than 15. So I get that dynamic is real, but I also think like, you know, there's levels to shit, right? And even now, like even at 45, I've had dudes who are under the age of 18, like try to holler at me, and I'm like, you are out of your mind, like you know what I mean? So, I get that goes that way, right?
Ain't nobody telling them.
That conversation is not being had though. Right.
So how do we have these conversations? We've seen last year, you know, women really step forward with Me Too and privileges of power. How do we have conversations in our community about our young people, our queer community, our trans women, and black women with these high HIV numbers? Like, why? Like, we're still not talking about it. What can we do? Is there a policy that can be enacted? We said the church maybe not the right place. How do we create safer spaces where we have these real conversations? Because the numbers keep going up. Regardless how you slice them, we're still higher, disproportionate than other communities. What can we do?
So there are a few places where you were on the face of the earth that people don't have sex. So I think very few places. Sweetie, tell us. Very few places. I've not been to any of those places, and I have quite a few stamps.
Where people ain't at.
Right. But with that being said, we have to be able to talk openly and honest about sex everywhere. So I will respectfully challenge something my brother said earlier. So you can't get HIV by sleeping with somebody. You can get HIV by having a condomless sex with someone, but not by sleeping with them. We have to use real words, talk about real situations. We have become, so this is the most PC place I've ever worked in my life. Is it really? It is. It is politically correct. It is an absence. So far, I feel so loved here and appreciated and valued. With that being said, I share an office with a guy, and we can say anything to each other. We want to close the door, and we want to have, I waited until he cursed first. But we'll have conversations that we wouldn't have necessarily in the lunchroom. And I feel that it's a safe space, and what he says is valued, and I believe what I say is valued. So we can then take what we learn, give and take from each other to our next engagements with other folks. And we should be having these conversations everywhere we go. It's ridiculous to me. There are people in church that are pregnant right now. Somebody at church right now is pregnant. So they're pregnant with sex. So why are we talking about sex in church?
I was going to say, I think for me, I had to stop worrying about safety. Like, if I'm going to fix this problem, safety can't be my first concern. And so a lot of times when I'm using my platform to talk about things, I'm getting death threats. I'm getting, I've had death threats. Someone is in here who was there today. I got a bunch of death threats because I tried to take on a situation that the world just wasn't ready for. And, but that's the type of work you have to do, especially when you hit an epidemic level in your community. You have to start to get radical. And so sometimes radical looks like stepping out into spaces that aren't safe. And I think the problem is a lot of people are too concerned about it being a safe space. And so we talk about this at USCA, and we talk about this, you know, at the HRC, and we talk about this in places where, you know, some people may tune in and some people may listen, but are you talking about it when you're in the barbershop? Or are you talking about it when somebody is actually saying something that is, you know, HIV positive phobic? No matter if there's some celebrity, and I'll say it because I'm sure I'll get some hate for it, but like there was a situation recently like where Cardi B said something that was very way too far, and a lot of us had to say what we had to say to call it out. I've been one person who hasn't been afraid to call out people with larger platforms when they make a misstep. But I also have been a person who's not afraid to start a conversation when everybody else is afraid to say something. And so a lot of times it looks like us having to, like we recently did with the U=U conversation. You know, like there was a lot of issues. Nobody wanted to talk about it. A lot of people couldn't talk about it because they work for organizations. I said, well, I don't work for nobody, so I'll fucking say it. And I said it, and then a whole lot of people was like, oh, well, see, George said it, I had a couple of gripes too with this. And before I a bunch of doctors across the world was saying it, and I was getting calls and I was getting emails, but sometimes that's what it has to look like if we're going to stop this epidemic. It has to look like the radical act of not just stepping out on faith, but stepping out on safety and doing something that hasn't been done before, because we've been doing it the safe route for a long time. And I will say this, when those federal dollars started to not just be a given a couple of years ago, because everybody was like, oh, you know, nobody will ever say that they'll stop, you know, funding HIV. Until that man got in office and said, I need to shift some money from the HIV budget. Right. And then everybody was like, oh, whoa, right? So that's why we have to now, it is dire times because it is our community, and we have to start to look at ways that are a lot more radical than safe.
Right. If I could, I would also say that we have to kind of go back to just like brass tacks organizing. Like I don't care what job I have, I'm an organizer to my core, right? So I'm always thinking about how do you build kind of networks and coalitions and alliances and communities of folks, official or unofficial, to leverage power wherever they are, right? Period, right? That's like how I roll. So I think, and so some of that is, I think it's the, like, you know, online shit is like really critical and important. And I think like that there's just, even if you just look at the data, there's a shift. Like my nephew and my niece who are 18 and 19, they're not on any of this shit that much, right? Like and my nephew who's 19, who has access to all the online stuff, but lives in a small, like kind of suburb, like of, you know, a county west of Cleveland, Ohio, is really looking for connection. Right, he's looking for people, like to do stuff with, and like whatever. And so I think, you know, and also because we're in a situation, particularly in most of our cities, where our, you know, Black gay organizations are closing, or in the threat of closing, even the clubs and bars are closing, and even I think to some extent the way a lot of the HIV funding segmented us as a community into young people, not young people, positive and negative, et cetera, trans and non-trans, and whatever. So all these things, versus, and I hate to be like the girl that's like, oh, back in the day, but like back in the day.
Right.
You know, when I was coming out in like the, you know, early mid-90s, like there wasn't, you go into the club, there was a spectrum of age in the club. There was a spectrum of gender in the club. And like, it was some of the like older cats who'd be like, oh no, honey, don't go home with him.
Right.
Like you know, like, don't, right? You know, watch your wallet, honey, with that one. You know, like all the things. I mean, like that, you know, but that's like, and I think like, just like not having a lot of those spaces and that kind of like mentorship, right? I mean, we talk about it or look at it in the house and ball community, and I was never in the house and ball community, but I mentor folks to this day, right? They're folks that are like my folks that I like, you know, and so I think coming back to figuring out like physical space with which to hold one another and which to build and have community with is a way to build towards safety, and I think can get us somewhere.
What is the role of healthcare in this conversation?
All right. Okay, y'all go. I'll go. Okay,
That's
so
a loaded question.
I mean, I think the role of healthcare is huge. I think first and foremost, like when we're talking about, you know, so just right now in the country, right, the vast majority of people living with HIV are in the southern states. The vast majority of the southern states did not expand the free fucking Medicaid when they could have taken the federal money in order to do so.
Facts.
That would have meant that people who were also in the states where people are living with HIV and have high rates of people who are undiagnosed, maybe would have gotten a Medicaid card and gone to the doctor for once and found out their HIV status and gotten into care, right? Maybe it would have meant that somebody who was thinking about PrEP but thought it was too expensive for them, maybe would have been like, oh, I got Medicaid, like this might then cover the, you know, the cost of it. A whole range of things. And what we've seen in the, you know, Louisiana, one of the few, I think one of two southern states that actually the only state that fully expanded Medicaid without work requirements, all the bullshit in the South, recently saw their HIV rates go down for the first time in the history of the epidemic, frankly. And, you know, and so, and Louisiana has had, Baton Rouge and New Orleans has been in the top 3 cities of, you know, HIV diagnoses for the last 20 years. So, like, healthcare cannot be discounted. And I'll just be very, and I'll say the other piece of it, so for people who are living with HIV, you know, I think we often sort of like default on what we have Ryan White. And I think Ryan White is great in terms of having a sort of catch for folks who don't have other kinds of insurance. But I can tell you from people that I know and love, partners of mine who have been living with HIV, people, you know, I've helped kind of try to get into care, whatever, depending on, you know, depending on where you are, whatever, or just the case manager or the receptionist, like how fast you can get into care is an issue. If the case manager don't file your, you know, your paperwork, you know, again, I've had people show up to go get their meds at their, you know, pharmacy and then find out that the meds are $3,000. Why? Because the case manager didn't file the paperwork. So I think that we, you know, or we recently this year published 2 stories of the body of 2 young men, one white gay man and one black gay man, one from Boston, one from Florida, who moved to Atlanta, Georgia, who, both of whom had been linkaged to care specialists and HIV service organizations in their respective cities and could not get into care themselves in Atlanta, fucking Georgia. Now, that's a problem, right? That is a problem. And so the feedback I got was, you know, people, some doctors I know in Atlanta in my inbox, like, well, why didn't you call me instead of having them publish? I'm like, don't be mad because you got put on blast, right? Like, be mad that people didn't get access to care. And the 2 people who actually are highly, you know, engaged and highly, you know, want to get into care, what happens to the people who find out that they're positive, are, you know, given a number to call to set up their appointment, and then, like, nothing happens, right? Like, so fix your shit and then talk to me, right? That was, like, my response. So I think the healthcare piece, like, is huge, and I think that we really need to be paying attention to it, especially because in this next election season, we're in a debate about the future of what any of this shit looks like for any of us, positive or not. That's it.
So I like to remind people, I love white people. I do, but I'm black, y'all. And I want to make sure that everybody understands the entire healthcare system was created by white people for white people. The entire HIV healthcare system was created by gay white men. So the Denver Principles, 1983, said that they would be able to live and die from AIDS with dignity. That's what it says. All right? They created the system to take care of themselves. When AZT was the very first drug that was available to treat AIDS, as it was called then, white people were taking with HIV, and granted, it did terrible stuff to people's bodies, but it saved a lot of white people. They would give black people the exact same dosage and they'd be dead in a week. Right. It wasn't made for us. All right? The entire systems of care, who knows, by show of hands, that highly active antiretroviral therapy became publicly available in 1995.
If you could afford it.
In 1995. Now, black people started getting it about 98. Right. It went nationwide in 96. Okay? Am I lying, Ken? Am I right? All right? So, we have to take control of our own health. If you're a person living with HIV and you're healthy, you might only go to see your doctor twice a year. Wonderful. But how are you still engaged in the healthcare system? How are you helping out somebody else that hasn't achieved that wonderful and magical undetectable viral load and maintained it? Right. How are you selling back into the healthcare system? I think that's really, really important. It's a conversation we don't have. It means that some of the onus has to fall back on people who are living with HIV. It's kind of a charge, a call to action to do something. Do something. Don't just take your medicine and not be engaged in the healthcare system.
And I would add, just to go back to what you were saying also, right, there's this, when I look back at the work that has been done that has led us to this point, right, when I think of Polly Murray or James Baldwin, and some of y'all drinking the Baldwin over there, but James Baldwin, Fannie Lou Hamer, Angela Davis, these folks who, they risked boldly. Yeah. They put their lives on the line so that we could still be here and confront this larger systemic issue of whiteness and say, this is not the end. We can not just, again, like I said earlier, not just survive, but thrive and flourish and take back what was taken from us. There are those of us who have achieved access to any amount of privilege, right, that we can say, I will choose then to put all of this on the line. I will risk what I have gained access to. I will risk whether it is my life, my resources, my whole being, and say, I will risk all of that for the sake of everyone else in my community. But there's a point in which I think some of us is like, well, I'm good now. And so y'all figure yourself out. I figured out how to get good on my own, right? And like, not to preach, but like that's, that's my training. So I apologize, but I'm like, we can choose in, right, to say, I will lay down my life for those in my community. I will choose in to that story instead of saying, like, baby, you're going to need to figure it out on yourself, right? There's a way in which we can change the narrative by saying we will also risk what our ancestors risked, with those just a minute ago risked, and say this is the end of this story of horror and terror and pain and death and disease, and say this is over now. We're choosing a new way.
Yes. So I want to talk about PrEP. So we have PrEP, which is supposed to, block the virus or save you from dying or getting sick. And some people are taking it, some people aren't. I think in the black community, a lot of my friends and peer group are like, Tuskegee, I don't know, what are the side effects? It's not really proven. And then, because I'm positive and I take meds every day, I didn't realize that with PrEP, like you also have to get your blood work, it's a lot of work with PrEP. It's not like pop a pill, you're good. So what do you all think about PrEP?
I mean, I'll take that one. I mean, it's great to have a magic bean, because that's essentially what PrEP is. However, but if we don't address the lived and holistic lived experience of a person, then how do we expect them to adhere to a medical PrEP regimen? I think we have to be in, Anthony Fox and I worked on a program with the CDC where it was essentially a PrEP navigation program in many ways, so funding through CDC 1509. And it was to provide services for Black and Latinx, MSM, and transgender people. But it seek to address the whole lived experience of a person. I think that if you don't have programming that address the whole lived experience of a person, then PrEP is not going to work. Like, you know, why would I take a pill every day if I'm dealing with homelessness, if I'm dealing with food insecurity, if I'm dealing with mental health and behavioral health issues? Why would that pill, like, what would be
That's not a priority.
It's not a priority of mine at all. So I think, and a lot of times when we have these conversations about PrEP, we talk about, oh, it's here, it's available, why aren't people taking it? Well, are we addressing the other issues in their life that they're dealing with day to day? If you're not addressing those issues, then that person will not be positioned properly to adhere to
affordability
and affordability.
access.
I mean, that's a whole nother level, though. I mean, before you talk about affordability, let's talk about, like, where do I live and where do I sleep? What do I eat? Like, the basic necessities I need to live from day to day.
Right.
Yeah, I think, so I've been on PrEP for 5 years now. April will be 5 years. And, you know, it took this, you know, once I, like, whatever, decided to get on PrEP, I got, you know, did the chest and blood work and all that. And then my doctor wrote the prescription, sent it. It was like, okay, what pharmacy you want to send it to? I'm like, okay, the one by my house, et cetera, right? And so sent it, and before I got out of the clinic, I got a phone call from CVS that said, hey, we just got a prescription for you. We can't fill it. Right? And I was like, huh? And so, now mind you, this was a few years, 5 years ago, I was the U.S. and Global Health Policy Director of Treatment Action Group. And I'm like, okay, so I go back into my doctor's office. The nurse practitioner says, okay, well, let me send it to, you know, the pharmacy on site and see if they'll fill it, whatever. So I go downstairs, they're like, we can't fill it, right? And so this is how I learned about prior authorization. And whatever, and it took me 2 days of cussing and screaming on the phone with, you know, my insurance company, with Briova RX, a specialty pharmacy or whatever. And how I finally got it sent to my doctor, the pharmacy I wanted was, I finally said to the person, I said, you might want to Google me. And I have never said that in this conversation. But I said, I did pull that card. I said, I'm an activist. I don't play this shit. I will have your asses on, like, a national news story. And I specifically do media strategy. So I will have your asses, like, a national story in the next week. So you go get off your, whatever you looking at, the software, and go Google my ass and see if I'm playing. She went away and came back and said, I have somebody on the line who can authorize this for you. And, like, and then I had it sent to the pharmacy. But, like, you know, I was 40 at the time, right? And, like, this is me trying to do it, and it shouldn't be that hard. But that's all cost control measures, which might, so sometimes, like, we act like the cost isn't the issue, but the way, the price of the medication, the cost control stuff is buried in the system in ways like this that actually dissuade people from getting access. That's number one. Number two, to the questions when people ask me about, you know, or kind of talk about Tuskegee and all these things, the thing I say to people is, look, right, we know the healthcare system is racist as fuck and all these other things, right? But let's talk about Tuskegee, right? Let's actually talk about it and not just throw it out there and then, like, run away like everybody, because I'll let people say that and they don't know what the fuck actually happened. And so what I say to people is, let's look at what happened. So there was obviously the issues around informed consent about being in a clinical trial that people did not have, right? So, and observing people, you know, with syphilis until, you know, they died. That was a huge problem. But another big problem was 10 years after the experiment started, basic penicillin became the prescribed treatment for syphilis, and they actively dissuaded. In the next county over, in fact, in Alabama, you could actually get treated and cured of syphilis, and they actually kept people from finding that out, right, at the time. So I often tell black people, we also have to think about when we are being denied access to treatment that we know that works, that is a racial justice issue and an issue of racism and white supremacy. So if we're going to talk about Tuskegee, let's talk about the fact that people were denied a treatment that actually could have worked for them to cure them of it. And so let's talk about PrEP in the same context, right? Instead of just letting people say, oh, well, or, you know, the pharma companies are making money off of you or whatever. Well, so is Beyonce, and you give her them coins every time she asks for it, without fucking question. So we make choices about where we spend our money, right? Like, and so, you know, so that's like the other thing. It's like, you know, you have to make a choice about if this is going to work for you and like how you're choosing, you know, potentially your health or just what kind of sex you want to have or whatever the issue is, right? And not let kind of, you know, people throw these things about Tuskegee and stuff out there for which they actually haven't really, like, it's just something that we say without knowing the details of which, because there's a really easy answer for that when you're talking about access to care. People were denied access to care in Tuskegee, and that was the real human rights abuse.
But also, like, can we talk about, like, practicality? Like, I'm HIV positive, and I struggle to take my pill every day. A pill that was, like, I was told I have to take this daily to live. Right. And I struggle to take that pill every day. So now you're telling people to take a pill every day
when they don't have
a chronic condition. And so it's like you have to really have conversations around like practicality. But then not only are you doing that, you're also now trying to tell 18-year-olds this.
Right.
And 19-year-olds this, and 20-year-olds this, and it's like these, like, how could that be the magic solution to anything? How could being that strict on some type of regimen be any type of solution to anything, to who I'm going to call them, to children? And I hate that, especially because black children are always aged up. Black kids are aged up. As soon as they turn 12, it is a known statistic that police start to look at them as adults. Right. And so, if we know every system of oppression talk to each other, so what other systems are looking at them as adults? Right. The healthcare system is starting to look at them as adults, and every other system is looking at them as adults. And so, when it's like, oh, here's PrEP, like, this will fix it. It's like, it's not going to fix it. Right. And like you said, you have this Tuskegee thing. Even if people don't even know the research of what actually happened at Tuskegee, they know because my mama didn't trust Tuskegee and my grandmama didn't trust Tuskegee, I'm not going to trust Tuskegee. So then we have to start talking about the generational trauma that has been passed down. Not even because we don't know the history, but just simply because my grandmother hated the doctor, so my mama hated the doctor, so now I hate the doctor. And that is something that I think our current generation deals with on a heavy level, because I literally, my grandmother, she recently passed away, and I think about, like, my mom still hates going to the doctor. My mom, even after watching the struggles of my grandmother, who fought cancer 6 times, and my family still has this thing about not going to the doctor because it's just like, it's just too scary to even know if something's wrong until I know something is wrong. And I think we all operate from that place of that generational trauma. And so I think a lot of work has to be done for us as this new generation that actually is fighting for access and actually understanding how healthcare systems work and intersect, and like you said, how Ryan White really should be a last resort and has become almost like a first resort, or the only resort for people. And then some people can't even qualify for that. Right. But you have people who are the working poor, and that's another thing we're going to talk about, where they make too much money to qualify for this, but don't make enough money to actually have health care. Right. And so these are all issues that we have to talk about, and I think that touches on Kenyon's biggest point, which is HIV is a social justice issue. Yeah. And at some point, the same way we fight police brutality, the same way that we fight against white supremacy, we have to also understand that HIV and just healthcare overall falls into social justice, and we have to start creating policy from grassroots levels that start to affect change in those areas for us.
I love it. I think on that note, we should open the floor for questions, because that was very powerful. Yes?
I have a question to the panel. Just this past week, the CDC had their leadership summit. And in that leadership summit, Bishop Barber spoke about the Poor Men's campaign that he's working on, and really brought some points about how we often talk about the middle class and really never talk about poverty feel safe. My question to you is, how do you see our role in being, when we talk about how do we get coalition, you talk about organizing, how do we, as black gay men, black gay, transgender, black gay, Latin, how do we then become a part of a bigger movement as well? And where do we see our role in the midst of what he's talking about doing in June?
The first thing we have to do is unpack the fact that nobody black is fucking middle class. That whole terminology about black middle class, what does that mean? Because when you look at the fact that in 2050 our net worth or our